The first time I met Dr. Sundararajan was on a shift that was particularly difficult for me, and I was just impressed firstly by her compassion and kindness towards me when I was having a bad day. This is what I've seen her do to and for all of our residents, the nurses, especially the patients that she comes in contact with. She takes action when she sees things that are unfair or not right. She is not afraid to use her voice to call attention to these things. And she always does it with kindness and a smile. She's been instrumental in a lot of the women in our department finding their own voice, but she also does more than that. She's provided many women with opportunities to do research abroad, to do projects here. She encourages you to follow things that may be outside your comfort zone. And what's nice is she never abandons you. She won't leave your side.
We're one of the fourth-year residents at UCSD and one of the 3 emergency medicine chiefs this year. I'm so delighted that Dr.
Sundararajan
was awarded this honor, this award for cultural diversity. I think she's the perfect recipient. She's done a really incredible job of teaching and acknowledging the cultural differences and the backgrounds from which our patients come, and in the setting of their worldviews and their cultural backgrounds. And then in a broader setting outside of the emergency department, she was the recipient of an NIH grant over this past year to help look at patients who have HIV in Africa. You look at the way that she describes that project, it's with a similar kind of respect for other cultures and other people, other prerogatives, and she's doing this project partly to help these patients who have HIV and have very minimal resources. And then sort of an equal part in that is understanding the culture that predisposes these patients to getting HIV and then successfully seeking treatment and continuing treatment. So understanding the setting in which all of that happens, partly to improve our knowledge and partly to improve the ways in which we can help those patients. I'm excited and proud that she won this award. I think she absolutely deserves it.
It's been an honor to work with the trainees in emergency medicine, and I've been excited and impressed to learn about their interests in promoting gender equity. From research to didactic experiences, we discuss ways that gender bias is embodied both in terms of how physicians practice, but also in the way that we speak to each other as colleagues. So it's been really enlightening for me to be part of that process for them, to be someone who can mentor them and can help them understand what their roles are in terms of advancing the practice, in terms of contributing to the next generation of trainees. So it's been a really special experience, and I couldn't be happier with the way that we've been able to work together and what we've accomplished so far.